What progesterone does in your body is that it stops you from ovulating, and at the same time it makes the lining of your uterus really thin so that implantation doesn't happen. But when it does that, sometimes your period disappears, right? So you can make your period disappear and then it can come back for a very long period of time and then it goes away again. Or you can have a period that still comes every month and is much lighter, much less painful. Or you can have erratic spotting. So progesterone is really like, every time progesterone is involved in the body, there's always some kind of erratic bleeding.
Emergency.
So people use it as a daily contraceptive, monthly contraceptive. It really is emergency. It shouldn't be used more than once or twice a year because it really is a high dose of estrogen and progesterone. It can really offset your entire hormonal balance.
Really?
Like it can give you abnormal menstruation for even up to 6 to 12 months after using it.
Hi guys, welcome to our channel. Hi guys, welcome back to another episode of Over 25. Hey. As you can see, we are the same number, but there's a bit of a difference. We've been joined, our stage, is it our stage, Emma?
Our set.
Our set has been graced by Dr. Kristina Sule. If you guys don't know who she is, we're going to leave all the details in the description box of this video, but she has her own medical practice for OBGYN, what do you call it, gynecologics?
Obstetrics and gynecology.
Yeah, obstetricians and gynecologists. Basically, our vagina doctor. It's called Alora Medical Center. Practice. And man, I'm telling you. And then, and basically she's come to talk to us about this conversation right here, contraceptives. Shiko is not here with us today because she is unwell, but she sends her love. In fact, she sent her notes to me. She's like, you must ask Dr. Sule about this and this and this. Yeah, so karibu daktari.
Thank you so much for having me. Thank you so much.
So
Again.
Actually,
yeah.
we did. She's been with us before. There's an episode we talked about. What did we talk about on that one?
We talked about a lot.
It was general OBGYN stuff, but we had a specific topic.
Wasn't about to do discharge and things.
Yes, yeast infection, abnormal
vaginal
discharge. And if you want more information about that episode, just follow this link over here. All right. Today, you have decided to come here and talk to us about contraceptives. We have had an episode on contraceptives on Over 25 years ago.
It had a part 1 and 2.
It had a part 1 and 2. Yeah. But this time we wanted to talk about it with medical, are you a practitioner? A medical doctor, to get a professional opinion, because we talked about it from our perspective. Again, if you want to listen, if you want to watch that episode, please watch it here. I think that one was very important because we were really
we gave our experiences
about contraceptives.
Yeah.
But we didn't have an opinion from a doctor. And this time round also, I think it's an important conversation because I don't know if you guys have heard of this sexual rights and health and reproduction bill, the SRHR. Yeah, but they're not even calling it the sexual bill, they're calling it the reproductive bill. Kenyans are so shy. It's sexual health and reproductive, sexual and reproductive health and rights. Yes. Although, I mean, it's very conservative. I think there are a lot of things that are not there that should be there in that bill. That's my personal opinion. But I think it's also important for young women to be empowered, and men, about how to take control of their fertility and their decision to have children or not, isn't it?
Yes, absolutely.
Yeah. So I think, am I right to say that we've all been on contraceptives here?
Yeah.
Some form of contraceptive.
Yeah.
I have. It's been a while. It's been a while, but I have. And Doc, I want you to tell us about, just set it up for us. I know there are different types of contraceptives, so maybe we can start from there. And also at the end of this episode, we're going to do a short Q&A because we had asked our audience to send in their questions. There are many.
I love
so
questions.
for sure we won't be able to finish all of them.
Right.
Yeah.
I wish we could even just do like an exclusive episode for just Q&A.
Yeah.
You know, that would be dope. But we can touch on some of them today and then take the screenshots of all of them.
All right.
Next time you come, we just do Q&A.
Sure.
Sounds good?
Yeah.
So clearly she's coming back. All right. So take us away. Types of contraceptives. We can start from there.
Actually, before we get into the types of contraceptives, it's really important to know that when you go to a gynecologist for contraception, they need to assess certain things before they just say, this is the contraception for you.
Right.
So they give you contraception counseling. They assess something we call medical eligibility criteria. So we want to see in your medical history, with all the diseases you've had or lack of diseases, is which contraceptive fits you the best. So for example, if you're hypertensive, not any contraception can go for you. If you have HIV or diabetes or any other condition, you can't just take up any contraceptive. So there's medical eligibility criteria that we go through to be able to understand what works for you. And then also just to mention that it's not one size fits all kind of process. You really need to just know what works for you. Just because a coil worked for your sister doesn't mean it works for you. So it's not one size fits all, and also it's trial and error. You when you take up a contraceptive, you don't really know whether it's going to work for you or not, and you have to try it, see whether it works for you, and if it doesn't work for you, then you give it a trial period, you get rid of it, and if it works for you, then you stick with it. So there's a bit of things that you need to consider even just before you take up contraception. But then now once you've actually decided that, like, look, my health is okay, I can actually take up X contraception, then we have different kinds. We have barrier methods, we have natural contraception, we have hormonal contraception, we have non-hormonal contraception, and we have surgical contraception. So like you actually have a surgery for you to have contraception. So there's different types.
Right.
Yeah.
I wish I did. When I was young, I didn't even go to the gyna. I just asked my pal, what are you using? Oh, it's called what?
Yeah,
and I went to the chemist and bought. And that was not, obviously I would not do that. Would I do that? Okay, maybe I would because to be honest, because I know it worked for me.
Yeah.
But I was lucky. What if it?
Yeah.
What if it did?
Yeah, because I remember we didn't have money to go to the gyna. And not everyone had medical insurance. So you ask your pals in Campo, what are you? Mwingine akona implant. My pal, another pal of mine was on the injection. Actually, she gained weight. And she's never gone back to her body. She had the hottest body I ever knew of in high school. And then, so I wish I knew to, or rather I knew, but I wish I was, like, it was reiterated. Just go and see a doctor first. This medical criteria, what are you calling it?
Medical
eligibility.
Yeah.
Because
Babe, I don't even think it's also about us not necessarily having money to go to the gyna. We're not exposed to this information.
Right.
Just not knowing.
Yeah, just women. I even remember when we shot that contraception episode 5 years ago, women were like, we don't talk about these things enough. So young girls were coming there to be like, okay, big sisters from over 25 are finally talking about contraception. I don't understand why it's not taught enough. And I had a question for Dr. Sule in terms of the types of contraceptives you've mentioned. Are all those for women only, or that also involves men? When you say what's happening
That
on the other
involves
side?
men as
Okay,
well.
okay.
I'm going to talk
Touch.
a little bit
Okay,
about
Sawa.
male contraception. It involves women and men, to answer your question.
Yes.
Sawa. Good, I'm happy.
Okay.
But I think even for me, even when I was getting my non-hormonal coil, I don't think my doctor sat me down for that assessment.
Yeah.
They should have.
To see if you're hypertensive, to see if you have diabetes.
I don't think I even, I don't remember that. I know it didn't happen because I don't remember it.
Yeah.
I just went there and I'm like, I think I want the non-hormonal one. Can you give it to me? And
exactly. And they just said
we're
yes.
like, okay.
Yeah. Actually, my second time round, like when I was a bit older,
Yeah.
I went to the gyna
And then questioned.
and then I questioned, but then he said, he just said, since you're young, you've not had a child. He just said, I usually advise young people to go on the pill. That's what he told me. But there was he didn't even tell me which brand per se. He said, just try that one that you try, continue or whatever. It wasn't like,
oh my goodness.
So I don't know what this criteria you're talking about.
I've never heard of it.
Wow.
Yeah.
That's crazy.
Interesting. Okay.
Right.
People's experiences are really different. I guess different gynecologists have their own different way of doing things, but this is the correct process. You have to have contraception counseling, medical eligibility. Because if you're hypertensive and I put you on the implant, your pressure will shoot through the roof. Surely I must know that you're hypertensive before I give you.
And also, I think something I really would love to mention is that you see those days, other than not having knowledge and not having money, there was a stigma attached to it.
Contraception.
And maybe even stigma is too strong a word. me at the as the 19, 20, 21. First of all, it was not called contraception. It was called contraception, but it was called family planning.
Yeah.
So in my head, I was like, bro,
I'm trying to understand.
that's a thing for people who are married.
Yes.
So if I'm doing it now, it means I am very, what is it, loose? What's the word?
Liberal. Let's call it liberal.
Yeah, but now I'd think, hey, sister, you need tabia mbaya, I'm putting for
The loose
myself.
is actually
Yeah, like
because of the stigma.
Yeah, so I was like, so that means I'm just trying. But the thing is, I was in a relationship, I was sexually active,
Yeah.
and I didn't want to have children.
Yeah. And it's reality.
And condoms, it got to a point, it was a beating. I don't know. It was. It became. Guys, let's be real.
Let's be real sometimes.
You
Let's
date
be
somebody for 4 years.
Yeah, like
It gets to a point where, like, So yeah, so and then when my cousin came from abroad, she had the pill with her. She's on holiday and they're there on the table with her makeup, and I'm like, she doesn't even
What is
hidden.
this?
No, I knew what it was. Then I'm like, so I was like, take these things, so you're having sex. She's like, no, I just don't want to get my period on a holiday, whatever. And she's so open, and that liberated me in a way, because I was like, why am I? Is it something you have to hide?
Yeah.
So you don't show the alarm when it's ringing. I mean, come on, guys. Me, I just can't live in a society like that anymore. We've come from far.
Very, very far.
We've come from far.
and then also this assessment thingy, the
Eligibility.
Yeah, that's a hard word for me to say. Is it a new, like a young doctor thing? Because maybe the old doctors are the ones who don't really.
Honestly, I don't know, because when I did my master's, that's how we were taught about contraception. It was, in fact, that was examinable. So like you'd get into an exam and they tell you, okay, tell this patient about contraception. You'd be like, no, first I need to check if they're eligible. And then they'll be like, well, that's a very good thing. So no, A for you. That's how it's supposed to be done. As to whether it was being done before or not, I really can't tell.
I think
but that's how we were taught to do it.
Maybe it's a new patient coming to you and you don't have their medical history. So I'm trying to think about maybe your doctor already knows your medical history. They know what is happening. So maybe it's a step they skip.
But even then, even if it's someone who's really known you, maybe say you haven't been seen in 6 months. In 6 months, anything could have changed. You could have become diabetic in 6 months, or you could have gotten maybe 10 new sexual partners in 6 months, and now we need a completely different form of contraception. So I just feel like it should always be done all the time.
Okay, noted. Thank you.
So you've talked about barrier methods. You've talked about hormonal, non-hormonal, surgical,
And natural.
and natural.
Yes.
I want you to touch on all of them.
Okay.
But I want to give you the liberty to start with the one you want to start.
Okay, let me start with barrier methods, because that's what everybody knows about. And that's basically condoms.
Condom.
And so condom is just like male condom. We have female condoms as well.
Yeah.
Oh yeah.
They're rare to get, also very noisy.
I'm sorry.
Female
They're
condoms,
noisy.
they make noise.
Yeah, they're like
Like during intercourse.
They squeaky noises.
like squeaky noises. They're very noisy, so most people don't like them.
Latex.
Also, they're very massive. When
They're
you look at
massive.
them.
They're
So
weird.
you have to
They're very
fold
threatening. You have
them.
to
Fold them to
Yes,
put
you have
them
to
in.
put them
And then
open.
don't you have to put them in sometime before you actually?
Yes,
Yeah.
like an
It's
hour
not like
before.
an hour before.
Yeah, it's
You walk around with a condom.
Yes, so it's
In your vagina.
Why do you have to put it before?
So it can enter the shape.
First of all, it's like okay, the way my professor explained it to me was like this. He said, it's like Formula One. The rubber needs to kind of get heated up exactly before it actually is good for you.
Oh, the guy can stick the thing in and then he'll shrivel up from the baridil.
I don't know. Can shrivel up, but it has to be inserted like a little bit
Okay,
before. It's
okay.
very uncomfortable. It's two rings
Yeah.
with a rubber in
man.
between, so it has to be folded in a particular way. I mean, it's really
Yeah, and then also,
it's
and then
horrible.
doesn't it interfere with the lubrication? Because the guy is
It could, depending on how much vaginal dryness a person has or not. Yeah, so it really honestly depends. So rare to get. I mean, even if you went looking for one right now, it would be so difficult to get. So there's that, and then of course the regular. Then we theoretically there's creams and foams that have spermicides, which are considered barrier methods, but they're so poorly available that I usually don't even discuss them, because if I tell you, say, Ivy, go get a cream, like where will you get it from? So I'm like, if it's not available, there's no need to discuss it.
Do spermicides work?
They do.
Okay.
They do to a certain extent.
They don't make your vagina toxic.
Yeah, and when you have sex, so you just have foam in your vagina.
It's a foam. It's like, yeah.
Yeah. Interesting.
Very rare to get, by the way. Like
Yeah.
if you went into a pharmacy, you wouldn't be able to get it. Yeah.
Okay.
But theoretically, they do exist. And then we have natural methods. And natural methods is basically like cervical mucus detection. So basically a woman would look at her cervical mucus, and depending on how thick or thin it is, should see whether it's a safe day or not for her to be able to have sex, not to get pregnant. There's also actual safe days that you can use, to see whether you're able to get pregnant or not. Then we have coitus interruptus, which is basically pulling out or withdrawal method. So all these natural methods, the efficacy is about 20 to 65%. Now you want a contraceptive.
But that's very large.
That's such a large range. For me, that's my problem.
Yeah.
So when you get a FDA approved contraceptive, they'll tell you this contraceptive is between 97 to 99% effective, for example. That's a very small range, right? You don't need something that's such a wide range, which means it could work, it couldn't work.
And it's a wide range in the lower area.
On the lower area, it's not even like 90
I wish
to
you know
100.
exactly, yeah.
So it's in the lower
Okay,
area.
okay.
So for me, I just find that very too wide, too unpredictable, and just like this is my personal bias. Yeah, this is not like what probably any other doctor thinks that. But for me, like natural contraception, I don't want someone to tell me there's an 40 to 80% chance that you can get pregnant with your contraception. But it is a method. People take it up for religious reasons, for cultural reasons, so it does exist. But just to let you know, these are the facts: 20 to 65% efficacy. Then we have methods that are, I'm gonna go to all of them other than non-hormonal, because that's the longest bit. That's like literally the majority of contraceptives are hormonal. So non-hormonal, other than the barrier methods, we have the copper IUD, which is non-hormonal. Basically, what happens is that if you're
maybe
eligible,
you can tell the audience what IUD is.
Intrauterine contraceptive device.
The coil.
Intrauterine contraceptive device, the coil. Many guys call it the coil. We have a different kind of coil which is hormonal, but the non-hormonal contraceptive that's not barrier is actually the only one is there. That's the copper IUD. So you get it inserted in the clinic. Insertion is painful. Yeah, it's not a walk in the park. Like it actually is painful. It lasts for 10 years. You can take it out at any point that you want to get pregnant. The good thing about it is that it's completely non-hormonal. The problem is that it can make your period quite heavy. Make it heavier.
That was
can
me
make you have.
Even when
I
I
thought I was gonna die.
to ask you, is this
I
normal?
thought I was gonna get anemia. I went under to get it inserted.
What?
Yeah, like I was kidogo.
I'm so sorry. Ideally, we don't give any anesthesia to insert it. You can take it out at any point before the 10 years are over if you wish to get pregnant. When we insert it, I like to do an ultrasound just to ensure that it's in the correct position from day one, because they do tend to shift about in terms of position. And then every year you have to continue doing an ultrasound just to make sure that it's in the right position. And we need to do an ultrasound immediately so that we know that it shifted and not that it was inserted poorly from day one. So if it's not in the correct position on day one, it has to be reinserted, because copper IUDs rely heavily on their position to function. So for it to give you contraception, it has to be in the right position.
So do the T, because it looks like a T, does the T enter the fallopian tubes?
No, it doesn't. It's literally just at the top of the uterus. It doesn't enter the fallopian tubes. Implantation.
But so it can fertilize?
Yes, fertilization can happen, but implantation will not, because the copper IUD does not stop you from ovulating. So fertilization can happen, but implantation will not happen. At the same time, the copper, another way it works is that the copper is toxic to sperms. So as the copper keeps being released, it kills sperms. And at the same time, there's also like an inflammatory reaction around the IUD. So it produces makes your body produce a lot of white blood cells that also kill sperms. So there's many ways that it works. The position where it is, the fact that the sperms are being killed.
Why do you bleed so much in the beginning?
I think it's just the fact that your uterus has a foreign body and that it's trying to adjust to that and trying to expel and contracting a lot. And also the copper reacts with the uterus as well, you know. So like you tend to bleed a lot and you can get spotting in between periods. At the same time, your cervical discharge becomes quite thick and heavy. But that's kind of the way the IUD works, because when the discharge is heavier, it's more difficult for the sperms to penetrate. Exactly.
Yeah, because what I remember, I don't know if it was high school or whatever, like maybe this is what we used to write in bio. The copper IUD or the IUD, it creates a hostile environment in the uterus. So the body just knows, okay, we can't have a baby.
Exactly. That is a hostile uterine environment. You're completely correct. So implantation can't happen, and even the sperms, they can't swim, they can't function very well. So that's basically what you're trying to do.
I just hope there's men watching this, because look at what we have to go through to prevent ourselves from having children. But I think it also just shows me that sex is such a huge part of life. You know what I mean?
But we had to go into so much detail to find
prevent
this.
because pregnancy is a lot of, it's a different, whole other ballgame, but it means that intimacy, sex and intimacy is a huge part of the human experience.
Yeah.
You know what I mean?
Sexual intimacy. Doctor, what would cause the IUD to shift?
Honestly, it's not known.
Okay.
So some people think it's sex, some people think it's a tampon, but really it's none of those.
Okay.
Some of them just shift and some of them just don't.
Okay.
I've had patients who've had the IUD for 5 years and it's never shifted. I'd have patients within 3 months, it's already shifted. So there's really nothing that makes it shift and there's nothing that prevents it from shifting.
Okay. And then now that you said there's a lot of discharge that comes out, what is normal versus abnormal discharge when you have an IUD?
So for it to be thick and like sometimes a little bit bloodstained, that's actually normal, believe it or not.
Wow.
However,
Every time I call Lorna, I'm like, babe, I don't know if this is normal. When I got my IUD a while back, I'm like, I don't know if this is normal. And Lorna was like, just, it is normal. But if it extends too much, because you're a guy now.
honestly, it's normal.
The best
but
advice.
again, if it, just as she said, if it goes on for too long, or if it gets really itchy or smelly, or has a burning sensation, or you get pain during sex, or now it gets to really actual bleeding, not just like blood-stained discharge, then you need to see a gyno for that.
I used to spot, or rather I spot like the day before my period comes when I'm on the IUD. And I swear, I feel like that spot, like the discharge smells like copper. Or like
a
metallic cleaning, and I'm like, is that my copper? Is it working? Is it working?
That's neither here nor there because blood has an iron.
metallic taste.
But it's different.
Yes,
It's
different.
Interesting.
It's kind of different.
Yeah. So what we don't want is a foul smell.
Yeah.
An iron smell, it might just be the blood, honestly, nothing else. Yeah. And then we do have surgical contraception, which is basically bilateral tubal ligation and vasectomy for men. Right? So bilateral tubal ligation generally is just like a very short procedure, 30 to 40 minutes. Nowadays we do it laparoscopically. Yes. Before we used to do it like an open surgery. Then we started doing something we call mini laparotomy, where it's kind of open but smaller. Now we do it laparoscopically. So we make a 1 centimeter incision in your belly button and then 2 half centimeter incisions in your side. Then we go in with a camera, we see your tube, we cut, we're out. So ideally it can be a day case. You can, go to theater.
They just cut, they don't pull out the ovaries.
No. We just cut the tube. So we're just cutting the connection between the ovary and the uterus. Which is really important to note because many women think that if you have a tubal ligation, like your libido is going to go down, you're going to have vaginal dryness and all that. It's nothing. It's literally,
will set in faster.
It will not, absolutely. We don't even touch the ovary. We don't touch the uterus. We literally disconnect the ovary from the uterus through a tube and that's it.
It's not reversible.
So that's the interesting thing. Some women come in and they say, look, I want a tubal ligation, and then later on they come and they say they want it reversed.
Yeah.
So it's not completely non-reversible. It can be reversed. However, the success rates of the reversal are really, really low. But the worst thing that I really don't like about the reversal is that it can predispose you to an ectopic pregnancy.
Exactly, because it's
so when you bring it back together, it forms a scar, and sometimes you can form a partial connection. So the ovum will get to the fallopian tube, it will get fertilized, but it can't move beyond the scar tissue, so it starts growing there, and then it will eventually rupture. It could be fatal to the mother. You could actually lose your life. So I usually tell patients who are having a tubal ligation, please be 100% sure, because the reversal, is absolutely, it's very dangerous for your health, and also unsuccessful. So even if you don't get an ectopic pregnancy, you probably won't get pregnant anyway. Worst case scenario for my patients who've had it and they really change their mind, because we're human beings, we change our minds. You could have IVF, you could have in vitro fertilization.
So if you want a baby, you're still. So does your ovary still produce?
It does.
An ovum?
It still does.
So it goes where?
It just falls into the pelvis.
And then it just
you have a
absorbs by
period?
the
Yes, it just gets disintegrated.
Also, you still have your
You
period.
still have your periods.
Okay.
You still have your periods. So basically, if you wanted IVF after a tubal ligation, we just force your ovary to ovulate, collect all the ova, combine them with the sperm, and then put them inside your uterus, because the channel has been closed.
you can also be. You can carry your own baby.
Yes, you can still. So worst case scenario. But I usually tell my
But
patients,
IVF is expensive.
very expensive, and also just be sure. I mean, just
How
be
much
sure.
is IVF right now?
400K.
So it varies. Each cycle is between, let's call it 400 to 800,000, depending on which center you're using. Most people require 2 to 3 cycles. It's not just like one cycle and you're pregnant, unless you're very young and it's very straightforward. But
Can you get a loan for it?
If you wanted
Yeah,
to,
you can
if
have
you
it.
could get a, I mean, like you could get
a loan for
a.
that.
No, I don't think you'd tell them that you're doing IVF because they'd be like, no.
Oh, okay.
Yeah, I mean, if
Okay.
you could get an unsecured loan or whatever you
True,
want to take money
true,
for,
true.
but actually, funnily enough, many patients do take loans to actually have
Yeah,
IVF.
I think,
Honestly,
yeah, you
many
should be
patients
able
do.
to.
It's very expensive,
But
yeah.
you see, you don't say that you're doing
Of course,
IVF.
you don't
just say
yes,
how.
but many patients do. Yeah,
Yeah.
many patients do. Yeah, it's expensive.
So when you cut the tubes, do you seal them? Like,
So-
or they just now float around? Like, I'm just wondering, how does, yeah.
That's a really good question. When we do cesareans, we just cut and tie them with actual suture thread. When you're doing a cesarean and you want a tubal ligation in the same setting.
Oh, because
But
that's the
when-
best time to.
Yes, it's
Yeah.
a really good time to just, especially if you had 5 babies and now you're having a cesarean, just get it over and done with.
Yeah.
Now, when you're doing, like for example, when it's laparoscopy, it's a thermal energy that we use to burn the fallopian tubes. So they just burn and a gap is created between the two sides of the fallopian tube. So there's no need to actually cut or anything. Yeah.
Okay.
Yeah.
It kind of seals
And it
both
just
sides
heals,
of
exactly,
this.
it seals and heals like a little knob.
Okay.
Yeah, on both sides.
Got
Yeah.
it.
So those are the surgical methods. Of course, for men, they have vasectomy. Nowadays, we actually do it under local anesthesia, which is really cool. So they come into hospital, literally 30 minutes later, they're out. The healing isn't too long, maybe 1-2 weeks. And then after about 3 months, they have to repeat their sperm count just to ensure that they're no longer releasing sperms. Yeah. Because again, it's a disconnection in a tube. So it's not that they're not producing sperms, they're producing sperms, they can still ejaculate, they can still have an erection. It's just that the sperms do not come out of the body. So 3 months later, you just have to repeat the test just to ensure that there are no actual sperms, because there are guys who have vasectomies and then before the 3 months, their wives actually get pregnant or their partners get pregnant because they never had the test 3 months later to ensure that literally there is now no more sperm coming out.
Yeah. So wait. Yeah, the sperm doesn't come out of the body as
Yes,
in.
because the tube
Is it
that
the-
carries
the
the
scrotum?
yes.
So there's fluid, but it doesn't have
Yes,
sperm.
Yeah.
It's
Oh, I
seminal
get it.
fluid.
The semen,
Okay, okay, okay.
because I know it's the sperm, they meet with the seminal fluid.
Yeah.
And then
okay, I get it.
Then it comes out, it's like right here. Yeah, okay, me, I think what I'm surprised by is the fact that people are having tubal ligations. Is it a thing? Is it common?
Yes.
Okay.
It's very common. It's very common actually. And funnily enough, right now it's more common in people who have less children. Before, there were regulations. The law was like you must have minimum 3 children and your husband must
Is
consent.
it? There was a law?
And actually not very long
The
ago.
government will tell you when
not,
you can.
not even
My
very
mom
long
had
ago,
one.
honestly less than 15 years ago. Right now it's up to the woman to consent. She doesn't have to reveal anything to anybody and she doesn't have to have a minimum number of children.
And she
Before it
doesn't
used
need
to be-
approval from her husband.
Not at all.
What?
As long as she's over 18 and as long as, I mean, literally over 18 and in sound mental health.
Yes,
Yeah.
yes.
So that's it. Informed consent, like literally you could be 18, you could ask for a tubal ligation. Of course, it'd be very difficult to get a doctor who's actually going to do it for
do
you
it, yeah.
because we also have our own moral,
Yeah.
beliefs and understanding. Like I wouldn't do a tubal ligation for an 18-year-old,
Yeah.
but legally she can have one.
Yeah.
Yeah.
Okay.
Yeah.
Okay.
How much does the vasectomy cost?
Honestly, I wouldn't know. I don't really
Okay.
do them. Urologists are the ones who
Urologists
do
are
it,
the
but
ones who do
honestly, not too
vasectomies.
much. I'm gonna say in the range of 60 to 90,000.
Yeah.
Yeah, not too
Okay.
much.
Okay.
Yeah,
Of
for
course-
a
of course
for a
the-
surgical
Of course,
procedure,
the female one is more expensive.
much more expensive because it's laparoscopic. Yes, much more
For women.
expensive.
All right, I think now we can move to the,
Yeah, the
hormonal,
hormonal,
which
yeah.
is the meat of contraceptives.
Yes.
And maybe you can just explain why they're called hormonal.
Well, they're called hormonal because they actually have hormone, yeah, and it's the hormone that makes you not get pregnant. So we have different types. We have first the combined oral contraceptive pill. This is the daily pill that you just take every single day. Well, not every single, but you take for 21 days ideally, or 28 depending on the regimen your doctor puts you on. I like to do 21 days and then you stop for 7 days to have your period and then you start a new cycle. And so your doctor did make a little bit of sense. It is one of the first contraceptives you give people to just kind of ease them into contraception, because honestly, if you start off like say a 16-year-old who's sexually active on an IUD, it can be a little bit tricky for her. Not that it can't be done, it can be done, but it's a little challenging like for her to undergo all these changes. So to ease people in, many gynecologists start off with the oral contraceptive pill. Now it's good because it protects you against ovarian cancer. It's really good for your skin. Many dermatologists use it, to improve your acne and all that.
And your boobs grow.
I didn't know that. I didn't know. But I guess it's possible because breasts do grow under the influence of estrogen and progesterone. However, it does have a few side effects. For example, oral contraceptive pills also put you at a mild risk of uterine cancer, and if used over 5 years, they can put you at risk of cervical cancer as well. They do have a small risk of developing a blood clot in your lower limbs because they make your blood thicken. So this is a little controversial. There's some studies that say that you can get a blood clot. There's some that say that you can't, and we can't ignore the studies that are saying that it does thicken your blood. And if you were to form a blood clot in your lower limbs and it were to dislodge to, say, your brain, heart, or lungs, it could be fatal. So these are all risks that people need to know when they're taking up combined oral contraception. It's not a dangerous contraceptive. I know I've made it sound a little bit bad. I know, I'm so sorry, but I really do need people to know what you're getting into when you do get into the combined oral contraceptive. When used over short periods of time, it's actually very safe and very effective.
But what does short mean? 1 month, 1 year?
We're talking less than 3 years. Okay. Much less than 3 years. Yeah. So
after that, we stop and then we shift to something else,
shift to something more long term.
Okay.
The problem actually with combined oral contraception is compliance. Nobody remembers to take it.
That's the thing. Even if you have 10 alarms, that one day you're like you overslept. Because I used to put mine in the morning. Then I'm young. I'm in the club on Friday night. Okay. So me, I'm like, see, my alarm will ring at that age. I put my phone as died. I always used to miss on Saturday, or if I sleep late.
And then God forbid, you get pregnant. Then if you're dating a mother, shall we curse a bit? If you're dating an a-hole, like, you've tapped me with but you forgotten, and it's sad.
And they have to be taken at the same time every single day.
Wow.
So time is also an issue.
Wow.
So if you don't, even the instructions tell you if you miss by 3 hours, you have to take a missed pill. When you take a missed pill, it kind of upsets the hormonal balance, which actually puts you probably at a higher risk of getting pregnant.
And then antibiotics.
Yes.
I do know about antibiotics.
So
when you take antibiotics,
it decreases
contraindicates. It removes
it. Decreases the efficacy.
You'll get pregnant.
So it's actually not just antibiotics.
What?
It's antibiotics, it's antidepressants, it's anti-TB medication, anticonvulsants. Like they all affect the efficacy. So if you take, and it's certain antibiotics, not all. So you take certain antibiotics and then the efficacy goes down. So whenever you're taking antibiotics, you need to be really careful.
Who takes these pills?
If you're on them.
People do.
Everyone, and it's the
it's so crazy.
Which, by the way, brings me to the fact that everybody should be using a condom, no matter what contraception you're on, which is just really important to know. Because contraception doesn't prevent STIs and HIVs.
Oh,
okay.
Right? Yeah, so everyone should be using
I get it, okay.
a condom, you guys.
But is it realistic?
It's realistic.
Okay.
It's realistic. I mean, it doesn't always work. Majority of people don't do it. For me, I say what you do is up to you, but just know what needs to be done. Yeah, that's different.
Yeah, so I remember I was on antibiotics, and then I don't know how the hell I knew this information. I was young, and it's a doctor who told me. She's not a guy now, she's a friend who's a doctor. Sorry. And then she said, I used to consult with her for free, and I'll never forget that message. She said, except when you're on antibiotics, because it contraindicates. And I was on antibiotics, and I did tell her. I don't know why I didn't tell her. So I was like, my God. Shit. So she's like, if you're on antibiotics, just use a condom.
Yes.
So I was on or abstain.
I never consider that.
Abstinence.
Guys, okay, you can't. Yeah, I was young. You're young and you're all your
blood is boiling. Your hot
I mean, now I can stay even a whole year. I don't care. But like, hey, I was like, what? I have to abstain for 5 days? I'm on antibiotics? Yeah. Oh, but the abstinence is also a form of...
It is. Of contraception. Yes, it is. Nobody considers it. Oral contraceptives are fairly effective. They're about 99% when used correctly. Majority of people do not use them correctly. Right? Nice to ease in, use for a short time until you're thinking of, something better along the line.
I think even like just the other day I asked, I put a story for this nurse. She's in Hosi and she's like, she uses ultrasound on herself, and she was checking to see, because it's happened before, if her IUD is at the same place, if she hasn't. And she's checking and she sees a sac, like a baby, and she's like, this is the second time. And then I just asked and said, have you gotten pregnant on contraception? You guys, it's like 79% haven't, 20 whatever percent have. Like everyone is like,
I have a friend whose baby,
who had a baby,
when she got pregnant, the baby She got a baby and she was on the coil.
Yeah, that happened. I mean,
And apparently it's a thing.
there's no contraception that is
100%.
So
99%.
Yeah.
Even 99.
If properly
Absolutely.
used.
Honestly, even the copper is like 92 to 94. Like, yeah, it's not even 99. Yeah.
Maybe I thought copper is 100.
No, I'll tell you the one that is actually the highest contraceptive
Okay.
effect, but like most of them aren't.
100%.
Yeah.
It's abstinence.
Abstinence.
Yes,
abstinence. Yeah.
Abstinence, man.
100.
Why do people, this one is
Just don't have sex.
this
That's a 101.
but not really because Mary,
Please, that's like one in a
Virgin
million.
Mary, did not have sex. She still got a baby.
But then, myth or fact, Dr. If a man comes on a towel and you wipe yourself with a towel, I'm not serious. Would that happen? Or
Honestly,
can you get
I
pregnant from pre-cum also and stuff like that?
Yes, you can.
Oh, you can
not
get
from
pregnant.
a towel,
Okay.
but from pre-cum.
From
Yes,
pre-cum?
you can. Yes.
How
you
long
can.
do the sperm survive on the towel?
I don't know about the towel, but in the
saying
body,
pre-cum.
24 hours.
Yeah, because once they
In
come
the
out,
body and around
maybe
the
they're
body,
just like,
24 hours.
We got you, bitch. Wait, pre-cum. Hey, to me a condom.
abstain.
Abstain. I love it. Okay.
Insane.
Right.
All right, so then we have other hormonal contraception that's progesterone based, yeah? And progesterone based contraception can either be oral or injectable or an IUD, yeah?
I see.
Actually, before I get to the progesterone based only, the combined oral contraception, you can have a patch. Yeah,
Oh,
there are
yeah,
people who
there's
use the patch. So it's a weekly patch. It has estrogen and progesterone. You apply it. You take it out after a week. Not my favorite form of contraception, only because a lot of my patients get pregnant on it. I don't know about other doctors. I'm sorry, I keep doing this. A lot of my patients actually get pregnant on it. So I don't know if it's just me. Maybe other doctors, it works very well for them. But the problem is, if you get a skin irritation, you can get pregnant. If a piece of it peels off and you don't get the full surface area, you can get pregnant. So for me, I just feel like too many variables. You know, if you wash in the shower and then a little bit of it peeled off or something, like, for me, just too many variables. Contraception needs to be reliable. Reliable, works the same way every single time, not depending on how you are feeling or what peeled off or whatever. So it is still a method for those who want to use it weekly, or maybe you're traveling and you literally just want it for that week. So that makes sense, yeah? So that's combined contraception. But then we have progesterone-only. You can take a pill. We call it the POP-P, progesterone-only pill. You take it every single day. You don't stop. Sometimes you get breakthrough bleeding on it because you're not stopping. We like to use it for mothers who are lactating because it doesn't affect their milk supply, and it gives them some time to decide what exact long-term contraception they want, because from 6 weeks you can actually get pregnant. And many times they come to see us at 6 weeks and they're not really sure what contraception they want. So we're like, look, let's just start on this, and then now with time you'll make up your mind when you're ready. So progesterone only. Progesterone only contraception can also come in form of an injection, the depot. Yeah, the one that you said made your friend gain so much weight. So it's either a 2 or 3 monthly injection. And basically what progesterone does in your body is that it stops you from ovulating, and at the same time it makes the lining of your uterus really thin so that implantation doesn't happen. But when it does that, sometimes your period disappears, right? So you can make your period disappear and then it can come back for a very long period of time and then it goes away again. Or you can have a period that still comes every month and is much lighter, much less painful. Or you can have erratic spotting. So progesterone is really like, every time progesterone is involved in the body, there's always some kind of erratic bleeding. Either it's not there, or it's too light, or there's spotting, or it's unpredictable. So I usually tell my patients, once you're on a progesterone-based contraception, just the bleeding, just be forgiving to it. It's not always very regular.
But
if you want regular bleeding, the pill.
The
pill is the one. Yes.
Every month, the 21 day one.
Yes.
But then there's but you've said 2 to 3 months. I remember my pal.
There's a 2-month one and a 3-month one.
She went on one for 6 months.
Maybe she kept doing it over and over.
No.
One or 6 months? No.
I remember she told me how she was like, actually, I'm on the job for 6 months.
No, there's no such job. It's either 2 or 3.
Okay.
Unless she was doing herbal. Herbal, there's even once a year.
No, we went to the clinic.
Jab,
I took her. I wanted to see this.
There's
thing.
no 6 months
How long
job.
ago was this?
Hey, I think I was 22.
No, there's no such job.
It's like 10.
It's either 2 or 3 months.
And why would
Very
someone
sad,
get that?
unscrupulous.
You know what? It's actually really, really popular in shags.
Even in
popular.
informal settlements, because it's a jab once you're
And you
done.
go away, exactly. And also, it's very discreet.
Yeah.
So nobody gets to know that you're actually, it's not like a coil where someone might feel the strains, an implant, someone might feel your arm. Literally, nobody knows that you had it. So it's extremely discreet. Yeah. Unfortunately, it has been banned in some countries in the world. And so for me, I usually say if it's banned in the West, then it's not good enough for my patients either. So I generally don't give it unless the patient really insists and she knows what she's getting into, but also unless I'm trying to treat a different condition using it, because it can be used to treat certain things.
Right.
So it's either a 2 or a 3 monthly injection. Then we do have the progesterone implant, which is like a small silicone stick. It's literally the size of a matchstick. So the insertion and the removal is done under local anesthesia, so it's not painful. It stays in your body for 3 years. It releases small amounts of progesterone every day, stops you from ovulating once again, makes the lining of your uterus very small. Now, some of the side effects of progesterone-based contraception, this is both rather the pill, the injectable, the implant, is that you can get weight gain. You can get weight loss, you can get acne, you can get vaginal dryness, you can get low libido, you can get headaches. And unfortunately, we don't know whether you'll get one of them or all of them or 3 of them or none of them. So it really is trial and error. You can get any of them, but it's good to be aware of, basically what you're having. Now, there is one more progesterone-based contraception, which is the hormonal IUD. Now, remember, all these progesterone-based contraceptions don't have estrogen, so there's no risk for cancer. Yeah, unlike the combined oral contraceptive.
So estrogen is the one that's linked
Estrogen
to...
is the problem. Yeah, especially for the breast and for the uterus, it's a big problem. Yeah. So when you have the hormonal IUD, we insert it in the clinic. Insertion is painful, equally painful to the non-hormonal IUD. It's not less painful, but it lasts for 5 years instead of 10. You can take it out at any point that you wish to get pregnant. The good thing about the hormonal IUD is that majority of the hormone is trapped inside the uterus. Yeah. So the manufacturer says that over 90% of the hormone is inside the uterus, and only less than 10% goes into your bloodstream. Now, unlike the implant, the pill, the injection, 100% of those, the hormone is inside your bloodstream. But with the hormonal IUD, over 90% stays in the uterus and less than 10% goes into the bloodstream. So the manufacturer says there's no weight gain, there's no acne, there's no libido changes. I've had a few patients of mine get acne because of just that little less than 10% that actually goes into your blood. Some women get a little bit of breast tenderness, some get a little bit of vaginal dryness, but the side effect profile is definitely much lower than the rest of the contraceptives. It's 99.96% effective, so it has a very, very low failure rate. So currently the most effective contraceptive on the market after tubal ligation, or in comparison to tubal ligation, basically. The good thing about it also is that if you have a small ovarian cyst or a small incidental fibroid somewhere, or you have a thickened lining of your uterus, we call it endometrial hyperplasia or mild endometriosis, it can actually treat that. So it gives you a lot of benefits in addition to just giving you contraception. As long as your fibroids are not too many, your cysts are not too big, your endometriosis is not too severe, it can actually manage each of those conditions and give you a lot of relief, at the same time giving you contraception. So it's also a really good contraceptive to bear. So those are basically the progesterone-based ones. And then we have the e-pill.
Right, which is emergency.
Emergency. So people use it as a daily contraceptive, monthly contraceptive. It really is emergency. It shouldn't be used more than once or twice a year, because it really is a high dose of estrogen and progesterone. It can really offset your entire hormonal balance. Like, it can give you abnormal menstruation for even up to 6 to 12 months after using it, especially if you use them repeatedly. Well, it doesn't give you a risk for cancer because we expect it to be used very infrequently. So we hope that it doesn't eventually give you cancer. But there's many combinations. The e-pill can have both estrogen and progesterone. It can have progesterone only, or it can have a completely different chemical called ulipristol. So it's 3 different types, but the majority are just the one that has estrogen and progesterone. Of course, there are 2 pills. You have to take them 12 hours apart, and as close as possible.
Two of
you can
them
take 2 at once.
Yeah.
Yes, you can take 2 at once, and of course, as close as possible to the time of the unprotected
ejaculation.
sex. So if the longer you move from that time, the worse it gets.
Yeah.
So basically, if you're looking at 4 days down the line, it's giving you very little contraception. After 72 hours, really, it's less than 20% contraception.
For those of you who are not 100% sure what we're talking about, emergency pill is P to Postina. Postina is a brand. There are many types of emergency contraception.
Yes.
And yes, like she said, it's supposed to be used in cases
emergency
of emergency
situations.
So usually when a previous contraception method has failed,
or maybe say during sexual assault,
yes,
like literally emergency.
So your condom has broken,
yes,
or somebody told you, oh, you didn't know you're supposed to be on antibiotics, you know. Like, then you go and get the emergency pill. Don't use it often because it can really mess you up.
Yes, it can. But one myth that I'd like to dispel is people think that if you use many e-pills, you will not get pregnant in future. That's not the case. There are very many studies that have been done. It does not cause infertility.
Okay. So can we say in general, we've kind of touched base on all the available contraceptives?
Yes, other than male contraception.
Yeah, because I wanted us to now jump to male contraception.
Yeah.
Just the other day there was, I don't know if it's true, but it was published by the BBC, so I'm assuming it's true. They said there's now a pill so that men can take. I don't know why I'm laughing.
They should.
Yeah. It's not all on us, but sometimes I'm like, you know, what time is your I mean, it needs to be an injection for 3 months.
That you watch.
Yes, you go with them
being injected.
and we see the doctor putting it in the syringe. See, Maggie, it's not saline, and they injected. Then now you can rest.
That's not gonna happen.
Because it's telling a pill every day. You know, for us, it's like we're the ones carrying the baby.
Yes.
So if we miss,
we do bear the larger responsibility of contraception. It's true. I mean, yes, I heard of the pill, but to be honest, a lot of the hormonal contraceptives or the male contraceptives are under studies. They're undergoing, several studies. We have something we call testosterone enanthate injections. We have androgen injections. We have anti-androgen injections. It's a very popular drug in China called Gossipol that men can take that causes contraception. But you see, the main issue with male contraception is that we need it to be acceptable, and that's very difficult.
Yeah, because how is it taking 100? How many years have we been on this planet? When did they discover? They will discover all these things for women not to get pregnant. But they're like us, we're okay. Men, do you get what I'm saying?
About so much effort and money has gone into
contraception for women.
And that's even the nice way to put it. Has gone into what do I say, guys? Because it's about our bodies, controlling the woman's body. But the man, it's so weird, man.
Yeah,
it's sad.
And they're all refusing. You've seen all the memes that have come out. At how men will be looking when they take this pill. A man with hips.
I'm like,
it's been a man-led
man, the
society.
patriarchy. Shit, man.
Yeah. Unfortunately, acceptability is a huge issue for male contraception, but also reversibility is a huge issue. Because you see, for contraception to be good, it needs to be reversible. Yeah. Unless it's permanent, which is a vasectomy or a tubal ligation, it needs to be reversible. And the problem with a lot of male contraception, the side effects can sometimes be erectile dysfunction, premature ejaculation, decreased libido, which even women go through decreased libido when we take certain kinds of
vaginal dryness.
Yes,
a lot.
However, for men when they get cancer, for men when there's erectile dysfunction involved and premature ejaculation, those are serious issues. Those are serious issues. So acceptability
women
and reversibility is a huge problem.
Sorry to interrupt you. I'm like, at this point, men don't want to do it. Listen, women are just going to wisen up. You guys, I'm telling you.
So basically, for men, the biggest issue is acceptability and reversibility of contraception. It's not that they're not there; they're there, but good studies haven't been done. I really don't know why. Good studies haven't been done. A lot of them are still, being investigated and all that. Honestly, I won't lie. I don't know much about this particular new pill, but I know that its uptake may not be very good.
Okay.
Yeah.
Okay. Yet we have a vaccine for COVID within a year.
Speaking of which, we have something called immunocontraception, where men get a vaccine that makes them decrease their fertility so they don't make women pregnant. Also undergoing studies, immunocontraception, very interesting thing, a vaccine that makes men not, be as fertile as they possibly would be. So that's another thing that's undergoing studies. So I like the way for men, everything is still under studies, but for women it's very
2022.
Imagine. It's because it's a lot of those people in those rooms are men.
Yep.
These researchers, and they're just like, do I really want? Nah, let's just get the woman. Me, I want to ejaculate, enjoy my sex.
Yeah.
But I don't want to take care of any babies. So let's figure this out. Yeah. All right, guys. Thank you so much for joining us today. Thank you so much, Dr. Sule, for gracing us with your presence and your wisdom.
Yeah.
Guys,
And your beauty.
And your beauty.
And her voice, she's always like so chill.
So calm, man.
I'm like, wow.
Thank you so much.
Yeah. We do have a Q&A session that we asked you guys to ask questions on our stories for Dr. Sule. If you want to hear the responses to some of those questions, we couldn't do all of them because, by the way, she covered a lot. She answered a lot of your questions in the video, but we selected a few questions. Just check out our reels, or that's on Instagram, or YouTube Shorts on YouTube, where she answers the questions. Thank you so much, and thanks to you guys for being so responsive. We had so many questions. I think contraception is a conversation that needs to be had over and over again. And like I said, if you have a really burning question that we have not answered, just go to Dr. Kristina's YouTube page. She does have a YouTube channel called Your Free Consult with Dr. Kristina Sule, or you visit her at Allura Medical Practice, which is in Upper Hill.
Yes.
Details on her Instagram page, and consult her and have you ask her 10 million questions. Go with your full scarf, okay? She's the best. All right, guys. If you've loved this episode, please give this video a thumbs up. Make sure to share with somebody who you feel like this information will be valuable to them. Leave a comment with your questions, opinions, feelings, commentary, and as per usual, subscribe.
It's free.
Hit the notification bell if you want a notification every time we upload an episode, and we'll see you guys here next time. Adios.
Bye.
Over 25, subscribe.